maybe we'll send something out, and so people can respond via email. But it's 11:36, so I think we're just going to go ahead and get started. Sarah, you can go ahead and start recording. Sarah
I have.
King, sorry.
I have. It's going.
Perfect, thank you. So let's just do introductions, and if Malik and or Casey joins, they can take over, but I'll just get us going. Everybody, I'm Donna Haney, not a commissioner. I am the assistant manager in our foster care program for child welfare. Jesse?
Hello, everybody. Jesse Powell, he and pronouns, commissioner.
Judge?
Okay, yeah, you got it.
Oh. Good morning. I'm Megan Jaco. I'm also a commissioner and a judge on the Court of Appeals. I've been on the commission for 2 terms now. Let's see, go to Dean.
Hi, yeah, I'm Dean Salazar. I'm a commissioner, and I also just got appointed to the Autism Society of Oregon Board of Directors as well. So there's that.
What is that?
The Autism Society of Oregon Board of Directors.
Awesome. Do you want to pick somebody else?
Oh, yeah, sure. Rachel?
Hi, everyone. Rachel Kearns Henry, she, her, hers. I'm with Governor Kotek and serve as her Senior Human Services Advisor. So I am here in that liaison capacity as you as commissioners advise the governor, and I want to ensure that I am serving as that vehicle as you provide input so I can report back to the governor. Thank you. I need to call on someone. Stephanie.
I'll jump in. Stephanie Brown. I am the executive director of the Oregon CASA Network. I am a commissioner, a brand new one.
Welcome.
Thank you.
Did you want to pick somebody else?
I don't know that we, is Sarah?
Well, both Sarahs.
Both
Okay.
Sarahs. Go ahead, Sarah Powers.
Hi, I'm Sarah Powers. I'm a pediatrician with Clackamas County Health Department, and I'm a new member of the commission. And I think the maybe only other person who's gone is our other Sarah, so I will call on her.
Thank you. Yeah, Sarah King, she, her pronouns. I am with ODHS Child Welfare and am helping on the commission in the absence of Ellen until hopefully a new person is hired in the next month or so. And since Rachel's here, I know we're still waiting on a few more people, but Rachel, did you want to kind of go ahead and give the updates or anything that you wanted to share?
Sure, I'd be happy to. Hi, everyone. It's nice to see you all today. Keeping this today informal and just want to make sure we have time for dialogue and just kind of tell you what's on the horizon and where we're at. So it's middle of August, and we know that September is when the agencies are going to have their agency requested budgets out. And those agency requested budgets are going to be a combination of here's what the current service level is, here's how much it costs to keep the doors running and doing what we always are supposed to do and what's defined for us, and with inflation cost and meeting the number of new people and demand that we have for services. So what's always challenging for DHS, I want to now acknowledge, is that the number of people needing services in the state is increasing. And that's not just for child welfare. We're doing a great job of making sure that we're getting kids served. But the broader DHS budget, especially with older adults and persons with disabilities, we have a lot of growth and demand for those services as we have an aging population and needs, right? So what happens when you look at the big picture budget for DHS is going to show we need more money to just keep the lights on and doing what we're doing. And then any of the requested what's many times called, sometimes you hear people call POPs or policy options packages. Policy options packages are what then the agency puts together based on feedback from community of ideas of what we could be doing differently in the budget. Any of the policy options packages that we have need to be budget neutral and help with efficiencies and savings. So there are a few that I know Rolanda and Michelle have presented on to kind of that are in the mix. Those are still in the mix. They're right there. And those will be part of that broader consideration. So you have that kind of combination of current service level, any budget neutral policy options package. And then the third component of what goes into the budget ends up being a list of reductions that the legislature request of the agency to do for up to 10% reductions. And all three of those are kind of building blocks, if you will, that are tasks that the departments must put together for consideration kind of in these steps of the process. And I'm sharing that because what happens after September is that's when we develop the governor's recommended budget. And the governor's recommended budget has to be budget neutral, and it has to be a balanced budget. And that's what we're tasked with doing when we submit the budget by the end of the year. And so we're kind of in that pivot point where you're going to start seeing materials coming out from the department. And what's going to be really important from my seat to hear from you as commissioners is clarity when you look at those reductions, or when you look at the policy options packages, or when you look at here's how much it costs to keep the doors running for child welfare. If there's feedback about priorities or what we think is really important that we need to keep doing as the Governor's Foster Care Commission, I want to make sure that I'm hearing that as commissioner, so that comes into that equation as we produce the best budget options that are available, knowing that we're not in a great budget environment because we have a really reduced federal funding environment to do a lot of the services that we need. And that's the real simple kind of description of process and timing of where we are. And Jesse, I see your hand raised.
Yes. What do you mean by budget neutral? Can you explain a little bit more what that is?
Yeah, what I mean by that in this context is that policy option package, a lot of times it is a new idea or something we want to do differently. And usually if you want to do a new policy or do something differently, that costs money. And so we said, we're not at a place where we're just adding. We need you to consider if there's savings someplace else in the department, or there's ways that we could do work differently to pay for what you want to do differently. That's what we mean by budget neutral. Can't cost the government more money than what we already have in that budget for the teams. But hey, if they have an efficiency for how to do something differently, or I think this is a value added, this program's going to have savings for us in the long run because it'll help us. That's on the table. So that's what we meant by budget neutral.
So, Rachel, I hear you saying that you don't want to hear from us like you have before, that everything is important and that you can't cut anything because something's going to get cut. Do we have an idea of how much it's really going to end up being? Is it around 5, or is it they're asking for 10 because that's the worst case scenario?
So great, just like getting to the point. No, we don't know those numbers yet. And that's a little bit of the timing of where we are. Those numbers about what does that look like? What do the final numbers look like? Those are going to be discussions for later in the fall, and we'll continue to have forecast every quarter. But what you're going to see is that the September budget are building blocks, just that, right? And so there is no decision. There is nothing that says we are going to be doing a 10% reduction at all. Please, no. That is a statutorily required deliverable that every single state agency has to do. But whenever you end up needing to produce that deliverable, that's going to cause fear, right? Because it's identifying reductions, but it is an exercise. It is part of what the agencies have to do, and it's going to be out there in the public domain, if you will. That's just a fact. And what does the overall budget look like, and what level of direction and kind of reductions will we need to make? And what does that look like for the department? I don't have a number yet. We don't have that number yet. We don't know what that will look like. But that will be part of what we're kind of putting together. And we want to always hear, where do we need to prioritize and preserve? What do we need to preserve? And that's most important. And having that perspective is really helpful.
Can I ask another question?
Of
Are we
course.
expecting that because DHS is a behemoth and includes SPD and all the other parts of the agency, that child welfare is going to be cut more because the population is aging?
No, I wouldn't make those assumptions. I would say that we really do look at the budgets by different programs. So we try and we look strategically at what's each program's budget. And you're going to see that, very, very clearly. Yeah.
That's reassuring.
Yeah. Yeah. I would just note that the governor remains very firm and committed that improving child safety is important and is critical, like making sure that we are providing critical services. The fact is we need to make sure that we are continuing to advance improvements and making sure that we have adequate investments, so that with the Wyatt Collaborative Agreement that we have that outlines, here's basic performance expectations that we have. Here, we need to make sure that we've maintained service and we maintain service provisions to be able to meet that improvement that is expected of us. So that is really important, and that needs to be considered. And I think those end up being those guiding principles, but it is helpful to make sure that we are all reminding ourselves of those guiding principles. This is what is foundational. This is why we need to preserve this work. And that tends to need to be the kind of common messaging that we all are stating, so that we understand why certain service needs to continue and or be preserved. So we continue to look at then the governor's child welfare improvement monthly report, and to use that as our guide to help us understand, how are we doing? How do we have that accountability and oversight? And I know that I've asked that we work on a feedback process where information that is going to be in that report comes to all of you as commissioners. So you're able to weigh in on that report that would be coming to the governor's office as well, to be able to see, okay, here's how things are going. How do we feel? Are there any adjustments or flags that we want to make sure that we are focusing on for accountability? And that's that feedback loop that we are have asked, in working with our co-chairs of this commission and the child welfare leaders, to begin working on, to get that cadence for how do we get those kind of data reporting in that right frequency. And as Donna noted, I think that's going to take some time as you're navigating the monthly schedule, and how do we, if you need to make adjustments to make sure all commissioners are able to be in attendance. But I think that's would be really important and helpful for us to make sure that we make really productive use of your time, and so that it's clear that you are helping to then help weigh in on reviewing how we are doing with some of that performance work, and then helping to identify where that means we need to preserve our time. So like one example, I know Rolanda has brought up as a good example, that's a really important perspective that we need to have is, and I'm thinking of you, Judge, we know that many times the court may order that certain services be provided. If the court is ordering that those services be provided, DHS has an obligation to ensure that they are providing those services, and therefore they need a budget for those services, right? So just even making sure that people understand that this is not, it's not because a bureaucrat behind the table is saying we must do this a certain way. It is about how the system works together with the families, with the court, the legal system, with the case manager experts that we have of like how do we need to ensure service provision. And that whole model needs to work. We need to have funding to provide those services that all those partners end up saying are really important that we all have together. And I think just sometimes even that brief kind of reminder of how that works and is really meaningful, especially ultimately the legislature and is going to have the ultimate say on how they define the budget and the needs in our state. So those are some of the areas that, you know, when we think about budget context overall, where I'm spending a lot of my time right now is, you know, we're in pretty good shape in terms of stabilized on child welfare right now. I'm just going to acknowledge that, like, we're in a better place than we've been in. We need to keep focus and we need to keep work going. Where we have challenges are where we have broader cuts in our system. Food security, for example, making sure people can pay for food, that they can pay for housing, that they can keep their rent, they pay for their utilities, continuing to have health care. That overall social safety net, and how are we making sure that we are mitigating harm for policy changes that have happened at the federal level that therefore shift costs to the states, and then the state can't provide services for people anymore. We have to then figure out what do we do about that and how do we help to navigate next steps and think about this. So that's part of where you'll see, and I'm happy to share an example. On Saturday, the governor just convened with convened a roundtable on SNAP access. And we spent a lot of time as well. Senator Reynolds was there speaking specifically to the impact on children and families and the need to make sure that we are thinking about nutrition in schools and thinking about those intersections as well to maintain what we have here in Oregon and to maintaining food access. Those will be, you know, that's where we're spending a lot of time. We're working right now collaboratively with the Oregon Health Authority and the Department of Human Services on implementation of HR 1, including new things like Medicaid work requirements, which are going to be coming into place at the end of the year. And how are we working on making sure that we have clear information is going to be going out to 600,000 people in the next few months about what actions they will need to take to be able to maintain healthcare. And how do we work with partners and making sure that we have our toolkits out and provider toolkits and information out so that we can maintain healthcare access for the broader populations. So all of that is just context for you to know of where we are navigating, and making sure that we have the continued focus and due diligence to make sure that we don't forget, in the context of all those changes that are happening globally, how do we ensure the most vulnerable and impacted kids in our system that need our attention are supported, is where you play such a critical role. And we need you to keep doing what you're doing to elevate and remind everyone of our obligations and our work that we need to keep doing for kids in the foster care system, period.
Rachel,
So
can
that's
I
my,
take you back
please.
for just one question? What is the timeline for effective feedback on the report, the monthly report of the child welfare improvement.
So I asked the department to look at and work with the co-chairs on that timeline, Judge, so that way they'd have a clear reporting cycle and then bring to you, and so that you'd have some sort of like, is it you're giving feedback either after the report's done or not for the next cycle? I don't know what that needs to be, Judge, but I said you need to be clear on what it is. If it's like, here's the report and here's how we're doing, let's get feedback by X date, and then that feedback will be incorporated into the next quarter report. I think that's what that would look like. But you're right, you need those clear timelines and specificity. And that's what I know that the DHS team is working on for what that could look like with the commissioners.
Perfect. Thank you.
I think that's all I had in terms of specific reports out and updates. And I'm happy to continue to answer questions and dialogue.
Yeah, I got just a little bit of perspective. So you had mentioned working with the co-chairs around some of the questions. One thing that you said really seemed critically important is how do we make recommendations around increasing your guys' budget line and what that would look like in conversation and context with us as a group. I like that idea. I think it would also be helpful if just beyond that line item conversation or recommendations that we may come up with, is there other areas that you can help us focus in on and have conversation around as well? And then with that, I feel like once the co-chairs have that structure and we start that conversation, we're going to have questions that our group are going to want to reach out and find out more information. And who are those people to get that information from? Like you had said something about if we make a recommendation about changing a program that is working and trying something else, we would need that information of the program, how much that program is costing, right? If we're going to make a recommendation for something else and how we can save money. So how are we going to figure out the math and all that as well? And like the outcomes of those services. I'm trying to wrap my head around how we would actually do that. And it doesn't make a lot of sense because of the communication, the data, the findings. Is it this year? Are we focusing on next year? The outcomes of the individuals that it's impacting. Like, I don't know how we can be data informed on making decisions when we don't, you know what I'm saying? It just, I think we need more structure around that. And I just like to bring that to your attention. Maybe,
Sure.
you know, yeah, and I'll just leave it at that. That's for because I want to be really intentional about what we do in our time and provide what you're needing. And I think what you said is exactly where we should focus a lot of our attention and support is around those line items, or creating a line item for DHS specifically around those outcomes. So
Thanks, Jesse. And let me just start by noting a lot of the work that you're talking about that needs to get done, like that's work that the agency does. That is work that the agency does, and they put that together for the legislature to ultimately make the final decisions on some of those trade-offs. And I was trying to be transparent about what is it in terms of that analysis work the agency has to do and when they have to report it up. And there is not an expectation that I have or that we would have that you all suddenly need to be helping to make those choices or those detailed at that granularity. I want to be really clear. Not asking for that. I think it's like it's about and we also owe it to you, and we want to make sure that when you do see those elements, that we have those right policy analysts in the program answering the questions that you have about what this program is, what this means, and why that's the case. We need to do both of those things. And ultimately, I think the feedback is about values. It's about your charge. It's about understanding the requirements and the obligations that we have as a state. And we're in more of and what is it that we need to preserve? And so I don't think that, I want to be clear, I'm not asking you to like embark on an exercise to help fix the overall budget in a way that is not that is outside of maybe your scope as a commissioner. But as a commissioner, when we present kind of the overarching, here's what this looks like, here's what we have, and what this budget looks like, I imagine you might say, yes, preserving these elements in this, the continuing service level for DHS for child welfare seems like a priority. And you'd weigh in more at that level, if that makes sense.
Thank you. That gives me a lot of clarity.
Yeah, yeah.
So you could use a recommendation from us that preserving parenting time is really important, and that we don't want to see any cuts to that piece of the budget, because that's, for instance, that's something that courts very often order, is for little babies, there's 5 visits a week or something like that to make sure they can bond with their parents.
Yes. Great example.
So another court order is usually that we see a lot that there's a big gap is safety service providers, right? And the parents not being able to have or identify those. And if they're court required recommendation or they're court required to have those, and if it falls on DHS, would there be money for paying outside agencies for safety service providers? Would that be a possible recommendation?
I don't know how
Right.
that current, like, I don't know how that currently is funded right now, and we would need that budget
not.
team to help explain that and navigate that. And then that's an example of, because if that is important, that's important to know. And in terms of that budget neutral discussion I mentioned,
Right.
it's not going to be in a department's plan if it costs more money and we can't figure out what else you would be taking away instead.
Yeah.
So that's
Thank
kind
you.
of that example of why there really is important work that we might want to keep doing and do differently. But this budget cycle might not be that cycle that you're going to see those changes happen, because we're really trying to make sure we're preserving the budgets that we have. But that doesn't say that we need the ideas to keep coming out and we need you to keep sharing what needs to change, because sometimes changing how we do the work is also a way that we can help to free up funds to shift in the future.
And that actually leads me to my natural, well, 2 questions actually in regards to this. So one is, have you guys identified any sort of like staffing duplication in some areas where it could be consolidated with minimal impact on the actual service delivery? And then the second question is, now I know like a lot of foster youth have trouble going places unless their their folks help them travel or whatever, because they don't really even also have like enough money for the bus system, especially in Portland, mind you, a lot of the time. And so I wonder if now I know that you want this to be budget neutral. So so my question is there any possibility of like DHS doing like a finding a way to like get a waiver for those specific, for specifically foster youth, so they can travel to different events and stuff like that? Because that's something that I think would also have a great mental health impact as well. Now, I know you could, give them bus passes and all that, but I know that's not revenue neutral. So that's why I'm thinking about like just like a paper waiver or something like that that has official seal to state or something with their name, etc. So I hope that would be minimal in that regard. So since Yeah, so those are my two questions for you, Rachel.
Thank you. So I'd say to your first question, absolutely, the governor's direction to the agencies is first to find operational efficiencies, and of course to find if there was redundancy or duplication, we wouldn't want that. And I would note that I think we have a lot of ways that we work with the department, and the department navigates to make sure that they're thinking about how are we doing work differently. And that's part of what you're going to see right now, where Director Wendt has been moving, is thinking about how do we deliver services and making sure that we are doing so in a more coordinated whole person way where we can be more efficient, so that self-sufficiency and child welfare can work hand in hand when working with a family. And so that is where we are seeing some of that kind of driving of how do we change how we show up for people so that we're helpful, more helpful, and it's more clear. And then I would say I don't have the answer on your foster youth transportation question. I think that's a question for probably the child welfare team. And the broader question, there's not a needing to understand what are you asking that's new and different versus what is it that is currently in the budget that they are required to do. And that is how the team will answer that question, is here is what we currently pay for and how we pay for it. And I think that's really important if your question is, how are we ensuring that foster youth are getting appropriate transportation? I think that's a question that like Donna and team can take back and make sure that they get you a policy response and a delivery response of how does that currently work right now. And if that's and I think that's important information to know before we kind of solve for anything else, right? How does it currently work now? What is broken? What works? What is broken?
Well, yes. I just the question was regarding if that was budget neutral. So yeah, or at least in concept, that was from your broad knowledge of the law. If that was like doable in a way that would be budget neutral. So that's all. Thank you.
And hey, Rachel, I know that your time, you might need to step out. I was thinking you had till noon. So I thank you for your time. And yes, Deanna, I can talk about the transportation and foster youth for sure.
Thank you so much, Donna. I appreciate that.
Yeah.
And thank you all for your time, and have a great rest of your day. Bye-bye.
Thanks, Rachel.
We appreciate you, Rachel.
Bye, Rachel.
So our next speaker isn't quite on because it's not quite her time yet. We're going to go into Malik and Casey had some questions about the hiring of the position that was formerly filled by Ellen Bell. And so I wanted to give an update on that. So I think we mentioned when Ellen first left that we have a 180-day, 6-month hiring pause for positions. It's a budget trick, I would say, to pause on, getting folks on board. So that 6-month ends towards the end of September. So we should be able to start the recruiting and hiring process. I'm going to go ahead and say the beginning of October. And so there will be a recruitment and an interview panel. And so it will take some time to get someone on board. I would guess that we won't have, oh, look who's here. Yay, Casey's going to be here. Casey's just popping on, which means we now have a quorum. So after this, if Vera's not on yet, we can maybe do 2 minutes. But Casey, you just missed Rachel. And I was just talking about the hiring of the new liaison position. And I was just saying, as you know, we had to wait 6 months. That's the end of September. Then we'll recruit and have an interview process. So I wouldn't guess someone will start until November. That's just a guess. And that's kind of if everything goes smoothly, because that person likely has a job and will have to give notice if they get hired. But previously, like when we hired Ellen, the chair, sorry, at that time was on the interview panel. And helped come up with questions. So and I know that was a question that had been asked, and I'm very open to if folks have thoughts on, interview questions topics you think should be covered, or anything else about the recruitment process. Casey, I know you are really, your schedule is your schedule, but if you wanted, or Malik wanted to be like a part of the panel, or if someone, wanted to be part of the panel, we could do that. But that's, like I said, probably not till mid-October. That's actually my goal, and that's ambitious, to be honest. Depends on how long we recruit for, and if we do open, competitive, or internal. My guess is we'll do open for this position. So it'll take some time, but we get to start it at the end of September. I think it's like officially the 20th or something like that of September. But absolutely want your participation in that process at some level. And I'm sorry you had a rough morning, Casey.
Donna, is this a full-time person for us, or are they half-time us, half-time something else, or?
Great question. So as you all know, and those have been around, Ellen was our first hire. And it was our experience with Ellen that the commission position really took about half-time. The legislatively mandated position is for the commission, but we also have to keep the person busy and working 40 hours a week. So the primary function of the position is the commission, but likely will be other tasks that are within the foster care program, because just a need to keep the person busy and productive and working so within the larger foster care program. And I should say that all of this is my news as of right now. If I hear something different, I will reach out for sure. But right now, that's sort of the cadence. Ideally, maybe beginning December, be great to have someone on board. So that's my hope.
I got
yeah.
a question. So is the is a requirement of the potential new hire or candidate to have ODHS experience? So
No.
are they going to, so they can have no ODHS experience and be able to apply as long as they meet the requirements of the criteria of the job duties, or what?
Yeah.
I'd be interested in, maybe we can see the posting of what the post would look like, and be asking, and then maybe from that we could also formulate some questions that we'd want to have asked in the interview itself.
Sure, that's a good idea about the posting. For instance, Ellen did not have ODHS experience, but so the person may or may not. Now, I will say that we can post positions that are internal only. We did not do that with when we initially hired for it. It's something I will talk with our position management folks about, because I also know there are some rules about positions that might be eliminated and folks that need to move. So that was brought up to me by our HR. So there are some internal things I have to deal with, but the quick answer is no, not really. If this is an open competitive position, then meaning outside of ODHS, then DHS experience isn't necessary. But I will say that OPA 3 position is a high level position within the department, and not really an entry level position. So Ellen had some really unique experience. You know, she had been an executive director of some private nonprofit and years school board, like lots of experience. So it's you know, it's finding that right fit, I guess, but it is a position that will need some level of likely human services experience and knowledge of agencies. So if that makes sense. But happy to share once we get to the posting and because there's attributes that we have to put in there, and so I'd love to get your feedback on that.
Yeah, I've been part of the ODHS hiring panel for like 2 full day sessions for the last
Okay.
couple months, and so part of
Oh,
that.
wow.
So yeah, here in D3, I've done two full day hiring panel interviews. So
I'm sure that's fun. No, thank you for doing that. It's really great to have folks on our hiring panels that aren't from within DHS.
Right.
So I was kidding, Jesse. I really appreciate it that you
Yeah.
would do something like that and take the time to do that, because that is important. But it can get 2 full days. That's a lot. That's a lot of,
yeah, I've done it twice already. Yeah, and then
Okay.
this last one, I was like, I'm stepping back. I'm not going to do that again. That's too much for me right now. But yeah, I learned a lot through the process about the attributes and the scoring panel and the questions and just all that internal stuff. So it was informative, and I enjoyed it. So
great. Thank you. Vera is here. And Casey, are you okay to go ahead? Yes.
So, yeah, I'm gonna step back, let you guys keep doing this because I'm gonna have to actually drive to Cottage Grove here in a sec. So going back and forth will be difficult. But since we do have quorum, if we wouldn't mind if we could just do a motion to approve the June and July minutes at this point. Would anybody so move?
I'd move to approve the June and July minutes.
I'll second
And do I
that.
have a
I'll
second?
second.
I got Jesse as a second. Any discussion on the June or July meeting minutes? Any changes? Hearing none. All those in favor of approving the June and July minutes, say aye or raise your hand.
Aye.
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 Any opposed? Okay, those are approved. We can go ahead and move on to Stephanie.
Yeah, I'm just abstaining from June because I wasn't here yet.
Perfect.
Casey, do you
Okay.
have time to set the stage for Vera? Because this is Vera's our
Yes.
ICPC program manager, and I know this is an important topic for you.
Yeah. So so welcome, Vera. ICPC was one of the issues that we brought up last week or last month on the commissioner's concerns. It was an issue that I brought up when essentially saying, when we started this commission in response to hoteling, one of the things that we've continued to look at is what can this commission do to protect Oregon and protect kids from having another issue like that blow up in the media where we were hoteling children. For me as an attorney, I see ICPC. So I'm sorry, I'm flipping 2 different things. ICPC. I'm sorry, I just got out of quick. So same thing, this was, we brought this up last month, but on ICPC, the issue here is that the Court of Appeals has said that ICPC, the Interstate Compact for Parents, I'm missing something there, does not apply to parents. And so normally it's a process that we have to go through with the state agency in a different state in order to place kids there. The agency, as I understand it, continues to use ICPC for parents. So even if we have a safe parent, we have to go through this very long process to place a child out of state. And they have to do that process because they need coordination with the other state. So the other state requires it, even though our Court of Appeals has said it doesn't apply. And so we really just kind of wanted to bring this to the commission to say, what are the processes we're using to place kids out of state? When we do have a safe parent, is there any process we can use to expedite it? And kind of so on, just laying the background a little bit and hearing about these out of state cases, when the issues and the process. Welcome, Vera.
All right, thank you. So yeah, Vera James, she, her pronouns, and I've been working in ICPC for 20 years this year. So a little bit of an ICPC gray beard or something. I don't know. I don't want to use derogatory language, but I'm using it as to myself. So anyway, so ICPC and parents has always been one of the most complicated issues with ICPC. ICPC stands for Interstate Compact on the Placement of Children. The ICPC, and I don't want to bore anybody, but I'm going to kind of give you the sort of foundation, which is the ICPC is a series, the official ICPC is a series of articles that are passed into statute in all member jurisdictions, which is all 50 states, the District of Columbia, and the US Virgin Islands. And so the language of the articles is identical in all of the jurisdictions, essentially identical, let me say. And so it's an agreement. It's not federal law. I know sometimes people think it's federal law. It's not, but it is state law in all the states. The problem with the current ICPC is it started being written in like the late 1950s, and it was adopted by states, you know, gradually in the 60s, and Oregon came on board in the early 70s. And so the language is pretty antiquated, and it does not cover all situations. And so it does not explicitly call out placement with parents. It uses some terminology that we don't even use today, you know, family-free home. What does that mean? I think it means an unpaid placement. But anyway, things like that. So, you know, there's been, you know, probably over the last 10 years or so, there's a national AAICPC association that has a representative, you know, from every state. We have compact administrators. Stacy Lowboy is our compact administrator. I'm the deputy. And so the National Association votes on things every year and regulations. And anyway, the National Association's position is that AAICPC should be used for parent placements, because the purpose of the ICPC is to make sure, A, that children are placed in safe and appropriate environments, and B, to provide ongoing like courtesy supervision, so ongoing monitoring of their safety and well-being for cases that remain in dependency. So that's the National Association's position, but the states have come down, I'd say almost half and half, about whether ICPC applies to parents or not. And I don't disagree. I'm not a lawyer, so, and I certainly don't presume to tell the appeals courts and the courts what to decide. I worry about it because, again, there's no way for us to get a home study or assure safety without ICPC. And at the same time, they're absolutely right. The way the language is written, it does not explicitly call out parents. So, so there's a good, well, let me step back a minute and say the National Association passes regulations for implementing the ICPC. One of those regulations is Regulation 3 that talks about what placements are subject to the ICPC. And so one placement that's not subject to ICPC is a non-offending parent. So a parent from whom the child was not removed, a parent where the court has no information that the parent is unfit, and a case where the court dismisses the jurisdiction right away. So when we have those, you know, non-offending parents from other states, and, you know, we've done any kind of sort of basic, you know, research to see, okay, we have no allegations against them. They're not, you know, we have no safety concerns. They can come here, get their child, the court dismisses the case, done. And so that can be pretty instant, right? I mean, as long as the parent can get here, and I know that the agency will assist, like the finances, if that's a problem. So that's,
can I
yes,
stop you there?
absolutely,
So
absolutely.
that has been interpreted to mean that it only applies before the jurisdictional decision, right?
Yeah, usually, yes, because once you have jurisdiction, then by definition, the court has made a finding that the parent's unfit, regardless of what that allegation is. But the fact that there's jurisdiction, yes. Go ahead.
So one of the things that becomes a problem is if we don't discover that there's an actual legal dad out there until after jurisdiction's been taken over mom.
Well, I don't necessarily think so. I'm talking about jurisdiction then over dad. Like if dad is the non-offending parent and we have no information that he's unfit, if we've established jurisdiction as to mom, but then dad comes into the picture, we're obligated to file a petition against dad, right? Because we don't have jurisdiction over him unless we prove that there's a reason we should have jurisdiction over him, or that the Oregon court should have jurisdiction. So
you-
regardless of when the dad shows up, you know, again, if there's no reason to believe that the dad, or regardless, other parent, dad or mom, is unfit, even if they show up after jurisdictions establish as to the other parent.
So ODHS would now tell the branches that they should return that child to whichever parent shows up later?
Well, that's what we would say if we know about it. We don't know, of course, we don't know about all the cases that are going in the state, in ICPC, I mean, but if somebody asks us, yeah, absolutely, that's what we would say. If it's a non-offending parent, you have no reason to, detain this child or keep this child from their parent. Yeah,
That's
dismiss.
better than I've seen in the past, so thank you.
Yeah, and if there's questions, if it's, appropriate, feel free to, I mean, I don't know what you all represent or whatever, but feel free to reach out to my office. Because again, we're not aware of all the cases that are out there, right? So, I mean, people don't necessarily know ICPC very well because not everybody uses it very often. And so sometimes, people are stumbling in the dark and maybe not doing things accurately. And, we're happy to jump in if we become aware of it. We being my office, my staff, and myself. So, were you going to say something else? You look like a pregnant pause. I don't want to cut you off.
Ask you if you would explain. I'm not sure how much experience other commissioners have with what the huge variety of how long it takes for states to
Yes.
get back to us.
Yes.
That I think
Yes.
is one of the main problems with ICPC.
Absolutely. 100%. It can take, 6 months more. It all depends on the state. It all depends on the situation. We, of course, have no control over what other states do. There's a general expectation that home studies be done within 6 months under the ICPC, which I think is still a long time for a parent. There's the federal law, but that doesn't apply to parent studies, but it requires for foster or adoption studies, it requires at least a preliminary report within 60 days. And we hold our home study workers to that here when we have requests coming from other states. I mean, we want to see that completed within 60 days, at least a preliminary report. So yeah, it's all over the map as far as how long it takes states. Another thing I think that's come up with states is that some states, at least in the past, some states have tried to hold parents to like foster care certification standards. And that's not appropriate. And so I think I'm seeing less of that now, but we've had that before where it's like, oh, I don't know, they haven't got their, TB test, therefore we're denying them. For example, I don't know, it's just a ridiculous example, but stuff like that where, other states have maybe some real tight certification expectations that we don't have. And then they expect the parent to meet those. And we're like, whoa. This is a parent. You can't expect them to meet that standard. So we push back on those. And like I say, I mean, we have national conferences once a year, and there's been a lot of discussion over the years about that. And so I do think that's gotten better as far as not holding parents to that standard. And then honestly, we have the kinship licensing standards. We call them relative standards here in Oregon, but that has helped. A lot of states have gotten on board with that. And I really think that's helped too, because it's like if we're able to work with kinship and relatives, we really need to be able to work with parents. So there's that. I did want to say a little bit more. So I'd say it's about half and half across the country about which states feel or which states courts have decided that ICPC is required for parents. And then there's some states where the courts have decided it does not apply to parents. And so those states won't even do a parent home study. So like California, for example, and California is county based, so each county kind of does their own thing. So some counties will do a parent home study. Some will go out and just do like a one-time safety check visit kind of thing and say, yep, everything looks good, or nope, here's our concerns. And then we make the decision about whether or not to place, but they're not going to supervise the placement. And then some counties, will do the full parent study and provide supervision. So it's all over the map, for example, in California, and we see that across the country. Idaho will do a home study, but they won't approve or deny the placement. they'll tell us the placement is recommended or favorable. And if they say it's favorable and we place, then they will provide courtesy supervision. If they say it's not favorable and we place anyway, then they're not going to provide the courtesy supervision. And so going back to the Oregon Appeals Court, which I believe was 2022, the decision came down that ICPC is not required for parent placement. So it didn't say it can't happen. So we're not interpreting it as you can't do ICPC for for parent placements, but it's not required either. So we're not running afoul of our laws or anything like that. We, ODHS, are not running afoul of that if we place without ICPC approval. Although, depending on the state we're placing into, that state may regard it as a violation, but we're like, well, according to us, our law, it's not. We always do recommend, particularly if there are concerns about the parent, we do recommend going through ICPC because, again, it's the only way we can get a home study. It's the only way we can get courtesy supervision. There are things that workers can do from here to get information about the parent. But like once we place, I think ODHS is in a bad position without ICPC to be able to assure safety for the child and ongoing well-being for the child, because ODHS doesn't have authority to practice in that other state. Casey? I can't hear you. I don't know if others can.
Casey, your audio is really patchy.
Mm-hmm.
He's driving.
I know. I heard that. I do want to hear what he has to say. Oh, there he is. Well, I can't hear you at all now. Can't hear you. But I want to hear what you have to say. And you can't put it in chat either, obviously, with you driving. Oy.
Casey, I'm wondering if it's trying to connect through your car and that's what the issue is.
Says keep going and
Go on.
he'll come back into it if
Okay.
he gets stopped.
That sounds good. Okay. So, questions, discussion.
So my question is, I understand that we could never get courtesy supervision if we place a child in another state and they've not agreed to do the full study, but can we send an Oregon caseworker to the other state to just make sure the environment they're placing the child in with the parent is like safe for a child to live in, like they would do for a foster placement? Not the whole foster placement home study, but just like to check and make sure that somebody could be a safety service provider or something.
We can.
I've seen that done before.
Yeah, we can. Like I said, the ongoing supervision is, I think, the harder bit because ODHS doesn't have authority in that state. So if something, if everything's great, then no problem. Our worker goes out there and sees the child. I can't speak to all states and their statutes. I know that Idaho requires their child welfare workers to, have MSWs and I think be licensed social workers. So I don't know if ODHS, could be running afoul of their law by having our workers go over there. I don't know. Idaho ICPC has never squawked about that. Sorry, I use informal language, but they've never really complained about it. So I haven't heard of that. My main fear is if something goes sideways, because our workers don't have the authority to do a removal in the other state if that, heaven forbid, becomes necessary. Also, our workers aren't going to know the local resources, so it's going to be harder for them to hook the child and parent up with supports they may need. But, you know, all those things can be done, but it takes a lot more, you know, legwork. And like I say, I just, my main thing is the safety of the child. So, yeah, Stacy put in chat that we would not be having the required face-to-face per rule. I mean, our branches can send people there, but
Well, it's a tricky legal situation, because if we don't have a basis to have jurisdiction over that
Oh, yeah.
parent, then we wouldn't have authority anyway.
oh no. Well, if there's no basis for jurisdiction, then I would argue, and I think the judges, certainly what I've heard from the judges for years now, is if there's no basis for jurisdiction, that case needs to be dismissed, period. And we need to be out, and ODHS needs to not have any responsibility for that family. I'm talking about the cases where we do have jurisdiction and where we haven't dismissed it yet. We haven't, you know, been ready to dismiss, or the court hasn't been ready to dismiss.
So do people have other questions about ICPC? I think the major frustrations I've heard from parties in my court is that sometimes it takes years for them to make a final decision on a parent or a relative, and that makes it really difficult for a DHS, especially if they don't have an ongoing basis to stay involved and the child is suffering in foster care, changing placements a lot, things like that.
Yeah. Well, like I said, if there's no basis for jurisdiction anymore, then there's no reason not to give the child to their parent. You know, because ICPC, as I said, is not explicitly, at least currently in statute, required for parent placements. So there's no, like I say, there's no reason to keep a child if we have a good, you know, good, I don't want to use that value judgment, but, you know, if we have an appropriate parent and there's no basis for jurisdiction anymore, then there's no reason to keep that case open. I think overall, you know, again, I've been in ICPC for a very long time. I have seen a lot of improvement with timelines. I think between the Safe and Timely Placement of Foster Children Act, I think between, you know, discussions at the national conferences, the kinship requirements, I really have seen things, you know, speed up a lot. There's your outliers. I'm thinking of a case I have with Florida that has been like 18 months now, and we don't have a placement decision yet. So, but that's really an outlier. From what I see now, it used to be much worse, I think. That's been my experience, at least. Of course, one option to expedite is the Regulation 7 priority home study. That a child will should automatically qualify for, because they hopefully have a significant relationship with their parent, the one that we're asking to be studied on. The only challenge with that is, depending on the parent's history, it may take longer than the Reg 7 timeline to assess that parent for the other state. Because we have to remember that the other state is coming in, you know, kind of blind. They're not coming in with the background information that we have. We don't know, you know, they don't know where this parent's been or what progress they've made, or, you know, so they have to, I think, be a little more, I don't want to say thorough, but, you know, they have to find out, do a lot more investigation that we've probably already done along the way. So we already know these things, but the other state may not know those things. And so they want to make sure for themselves before they approve the placement. So that's what, you know, but we do send Reg 7 requests for parents too. Go ahead.
Doesn't Reg 7 only apply to kids of a certain age? Don't they have
No.
to be younger?
No, that got changed. I think it was in 2012. They expanded the criteria. And so one of the criteria is age-based. They actually raised it, but that's for 4 years. And it's just one child if it's a sibling group, one child in the group. But there's also, if the child is in unexpected dependency, like, you know, their parent got incarcerated suddenly or got, you know, sick or passed away, that an unexpected dependency, or if the child is in a shelter placement. So, you know, if a child is is in TL or looking at temp lodging, that's definitely. And then the other one, though, is if a child has a significant relationship with the caregiver, which again, I would hope with a parent would be the case. It's not always, I get that, but so one of those findings, I think a judge, could find applies to the case. And then the parent is the other, because the degree of relative is the other criteria for Reg 7, and a parent fits that 100%. That's an option to try. We can't always guarantee that it'll get, a placement decision within 20 business days, but at least it'll be expedited.
Well, that's encouraging that that's broadening a little bit.
Yeah.
Casey, you're back. Can we hear you now?
Yay.
Can you hear me?
Yeah. Yeah.
Yes. Yes.
You're right. I had to pull over and stop my car to get it off the car audio. But actually, Judge Jaco asked the question that I was going to ask immediately after that, which essentially was, I understand the need for ICPC when we have a parent who's been determined unsafe. Even though it may not apply, I understand the need to have an ODHS courtesy worker. My question, as Judge Jaco put it, was really about, when we have determined a parent to be safe. The follow-up to that, I think she also asked, which is, why can't the agency just go out and do it themselves? As a follow-up to that, will the agency ever do that on their own accord, or do they require a court order to fly out to Kansas or whatever other state to do a home study?
My experience has been that the agency will do that. A lot of times they may consult with my office, and then we'll give them the whole ambivalent spiel that I've just given you, like, well, we recommend it, but sure, go ahead and go out. And yeah, so I don't know that I've not heard that branches are requiring court orders. I don't know, Stacy, maybe have you heard anything statewide about that? I haven't.
No, I have not heard. I know that we typically, as you all know, need the court order to place the child into that other state. So when we do have that approved ICPC, but I have not heard that we're seeking that out. I just know that generally we have really cautioned against sending a worker to do any sort of assessment or analysis of a safe placement, given that there's no jurisdictional foundation for an Oregon worker to be able to go into California, for example, and make the statement that the home is appropriate in that state.
Yeah, I'd also raise the issue that if you look at the definition of placement, it does not include a parent. A definition of a placement under ORS 419B is anything other than a parent. And so, I think when we look at placement, we're looking at anybody but a parent. But okay, that's helpful. Thank you.
That's the basis of Court of Appeals decision.
Yes. Absolutely.
Oh, I had one final question on this. So we all acknowledge ICPC takes 6 months to a year, and in rare circumstances, even longer. Over the course of a case, a parent can become safe. And so oftentimes what we see is, 6, 8, 10 months into the case, the parent's now doing well enough for the child to be placed with them. But then we begin the ICPC process and we're waiting for a year after the parent has been determined to be a safe parent. Is there a point there where we could start doing ICPC when we have an out-of-state parent at the start of the case, even though they're not yet safe? So that, do you see what I'm saying? So that we're not having this year delay?
Well, first of all, I would push back a little bit on the year delay because I'm not aware of it being like that for parents anymore. And if there are cases like that, I want to know about them. But I will say that if we do it at the beginning of the case, basically states are going to be looking at, is this parent ready for an in-home plan? Because ICPC is about placement of children. And again, on the national level, we look at placement as being with parents as well. But so they're going to look at, is this person ready for placement? If it's real evident right on the face of it that, oh, hey, they still have a lot of things to do before they'll be ready to have this child with them, they're not going to approve it. They may not even go forward with the home study. They may just say, no. And honestly, Oregon does the same, because it's like, we can't, we're not gonna be able to approve it. So why would we even, put the parent through the home study process? But, there's always, like I said, I mean, there's always the Reg 7 option. You can, it doesn't have to be ordered at the beginning of the case. It could be ordered at any time. So if you get to the point where the parent is safe, then you can always order the Reg 7 at that point, or the judge can. There are a few states who won't do Reg 7, so I do need to say that too. It's very interesting when you work with all these other states and jurisdictions, and they all do their own thing. But also, again, I mean, I think legally, and again, I'm not an attorney, I'm not a judge, obviously, but over the years, I have learned some things. And again, if there's no basis for jurisdiction anymore, I have certainly heard from judges that they can't maintain the jurisdiction. They have to dismiss it if there's no longer a basis for it. Because then, I mean, the parent has the right to their child. So there's that too. Casey, you raised your hand.
Yeah, I just was going to add, Casey, this is such a great topic of conversation, because we have this conversation not only internally, but Vera and I also, when we have our annual business meeting with the other jurisdictions. These are absolutely complicated conversations. And what I will say is Oregon, I think, does a really nice job of supporting parents and having children return to parents. And also we do a really nice job of ensuring that home studies get done timely, and the importance of placement with relatives in Oregon. And so you see all these things happening in Oregon with ICPC. We don't always see it reciprocated in other jurisdictions. And so while Oregon we're very open to, if the child is already placed with a relative because of circumstances, we're open to saying, you know what, we understand, we want less trauma for the child. We're going to continue to do a relative home study, even though the child might be there on an extended visit from that other state. So many other jurisdictions will not do that. And they will say, come get your child. That child's already there. Now we're going to deny the study. So there are a lot of hurdles in other jurisdictions that we try to utilize our examples of the importance of placement of children to say, I get that, but this is what's really important for this child. And this child really needs to be with this parent, or they really need to be with this relative. But if we get a state that doesn't want to play nice in the sandbox with us, they could deny that parent study, and they don't have to try to do it again. And so there's a little bit of political balancing with some of the other jurisdictions.
So what's within our control? I hear that we're relying on other jurisdictions, but what could we do here in Oregon to speed up that process when ODHS is in agreement that it's a safe parent? Otherwise, safe prior to dismissal.
Okay, so safe but not ready for dismissal is what you're saying.
Yeah, like
just to be clear.
ready to be reunified,
Right.
but not quite ready for dismissal.
But still, exactly. Just to be clear, yeah. So, because again, if it's ready for dismissal, it should be dismissed. I'm definitely not an advocate or proponent for keeping children from their parents or keeping the agency involved when they don't need that or shouldn't have that anymore. The things we can do from Oregon, like I've been suggesting, I mean, there's Reg 7 that can be ordered by the courts. Not a guarantee of success, but it's worth trying.
Sorry, Vera, just to clarify my question too, it's more on like a policy area change. Like, is there anything that we could recommend on a state level for changes that could expedite that process? I'm sure you've had those conversations before, but if it's something that the commission could put their support behind, understanding that some things would be legislative and take a long time, but have there been discussions about things that could be done, but we're just legally not able to do at this point?
Well, and I may defer some to Stacy on this too, because again, we're dealing with other jurisdictions and their rules. We're not the boss of other jurisdictions, so we can't tell them what to do. We have looked nationally at passing a revised compact, but I'm not sure that actually helps you as far as maybe getting, I don't know if it will help with getting placement decisions quicker. In theory, it should be. Now, the revised compact, which has states are in the process gradually of passing, one of the things, it does explicitly include parents in ICPC. It does still have the provision about, you know, if there's no basis for jurisdiction, then the case should be dismissed and ICPC does not apply. It also puts in timelines. And the thing, I'd say one of the big problems with ICPC right now is that there's no teeth in things. I mean, we have regulations, but, you know, states are like, nah, I don't follow it, or, you know, well, we can't meet that deadline, and there's no teeth in it. There's no, you know, there's no enforcement mechanism. There's no way of us, you know, going back and saying, well, you know, it's anything. I mean, we're just like, oh, shame, shame, shame. And, you know, we're mad at you now. You're not on our Christmas card list anymore. And, you know, that doesn't do anything. But with the revised ICPC, if we can ever get that through, that does establish a commission that will have more sort of, I guess, enforcement powers, and that can level sort of sanctions against states that aren't playing nice, that aren't following, that aren't meeting timelines, for example. So that's something we have been trying to get past thus far, not successfully.
Do we know if Oregon's actually considering it?
We have put it forward twice. It's gone as far as committee. It went to committee, not the past long session, but the session before that, and it did not get out of committee. So that, you know, if the commission wanted to take a look at it, I don't know how y'all will feel about it. I mean, from an ICPC perspective, from a child safety perspective, I feel very strongly that it would be helpful. I don't know, and I think it would help with the timeframes, but I would really encourage you, and I can send Sarah, you know, the link to the national website for the AAICPC, the association, and the text of the new compact is available on there, so you could review it and see if that's something you'd want to put your support behind, because that would certainly be very helpful, I think. Stacy, would you agree with that? I know you're pretty familiar with the revised compact as well.
Yeah, I think it would be helpful to share it with this commission so that there is an opportunity to take a look and see what it is. And so we've been, as Vera was mentioning, trying for a couple years, and I think we got it in front of the House Senate Committee. Is that right, Vera, where you testified?
Senate.
Oh, excuse me,
Senate
the
Committee.
Senate. Yeah, sorry. And then it didn't go further than that, but we definitely talk about it at the business meeting annually. And we have to respond to the commission, to the ICPC, to say, you know, why isn't Oregon moving it forward yet? And so we do share that legislatively it hasn't gone forward.
Stacey, do you know what was the hurdle, what problem it faced in committee? Was it a Senator Gelser problem or something else?
I believe it was Senator Gelser and her committee that talked through that. You know, it's a committee decision, so I don't want to say it's specifically one individual because it's voted by the entirety of that committee. Sorry, my phone was going off with an alarm. There's a little fire nearby.
Ooh. I can also say, from my perspective, the revised compact has, you know, talks about all different situations. And so one of the things it talks about is residential treatment when states are looking to place children across state lines for residential treatment. Now, you all probably know that we don't do that here. I mean, we have very stringent rules around, you know, if or when we can place children in residential treatment across state lines. However, you know, the revised ICPC says, if you're going to place across state lines, here's what you need to do. And that, I think the committee was worried that that was an attempt to undermine or, you know, sidestep the statutes around limiting the out-of-state residential treatment. And that was not, and that's nowhere near the intent. It's just, you know, if you're going to place, if a state's going to do this, because a lot of states do, and these are the rules, these are the, you know, this is how you do it. It doesn't mean you have to do it, but I think that it seemed to me like that was a big place where the committee got hung up, because, you know, the RTC statute is very important to them, and they didn't want anything undermining that. And yeah,
That makes perfect sense. But if you could send us that link, that would be helpful.
I will, absolutely. Well, I'll send it to Sarah, and I guess Sarah can distribute it.
I can do that.
Okay, thank
That
you,
would be
Sarah.
great. And just, I know, Casey, did you want to say something? Sorry.
You're
You're here now. It's all
I see
yours.
the time. Yep. So thank you so much, Vera. Really appreciate it.
Absolutely.
That was enlightening. I know the judge and I had a lot of questions there, but really appreciate your insight on that. Certainly, you know, if I had to make a recommendation, it's for the commission to review the document that you've been talking about, which is the revised compact, and then potentially we can put that on a future agenda to discuss that and see if we want to support it. Moving on, do we have any other commissioners' concerns or updates that they'd like to share? And this is a great opportunity to bring up an issue that you'd like on a future agenda. I don't know if we've ever made that clear, but we take this information and it goes on this meeting minute. And then when we meet with ODHS and the governor's office and Sarah at the beginning of the month and discuss the agenda, we're looking at these things to try to fill in gaps.
And to
I'm
that,
just going to
Casey,
sign off.
really-
I'm sorry.
Oh, thanks,
Or,
Vera.
I don't think you need me here anymore. So thank you
Thank you,
so
Vera.
much.
We do
Bye-bye.
have self-selected environments. The person, the subject matter person for that coming next month, just so folks, because I know that came up last month.
None this month for me though, because I already got that, well, you know, with Donna. So, you know, regarding the foster youth, you know, transportation thing. So, but yeah, next month I'll probably have something.
Okay. The other thing that I want to start doing, if we can, at the end of every presentation, is just asking if any commissioners have any recommendations or follow up for that presentation, so that, you know, if it's a recommendation for a letter to the governor or something in the legislature, you know, we're keeping track of that and we're doing next steps with it. So also, as we're in this section, if you had anything additional on ICPC that you wanted to follow up, feel free to mention that as well.
I'd just like to further, like, how you want to move it forward to bring it in front of us and review it, and maybe make some recommendations on it. Casey?
Sorry, I missed the beginning of that, Jesse.
Oh, I'm in full support of what you want to do about moving the you know, reviewing the information and maybe putting a recommendation for that policy change for ICPC.
I think I talked earlier in the meeting about looking at like workforce development stuff. You know, especially if you remember that. Sarah, if you remember that, actually, I think I talked to you about that. Would you be able to like look into that?
I can try. I don't think that is specifically like with child welfare. That's a different like group. Like workforce development for individuals would be like vocational rehab. So
Yeah,
I don't know, and I'm not sure if that ties into this commission or not. I will default to Donna.
Don't worry. Yeah, no problem. I just wanted to like follow up on that, see if that, I mean, but, you know, it's been a long hour and a half, so like I forgot some specific details. So I wanted to make sure, like, if it was relevant, then that, you know, we got that. So cross our T's, dotting our I's. You get what I mean?
All right, we'll come back to that if it's needed on the workforce thing. We'll look into that. But all right, well, hearing no other. Oh, Judge Jacob.
Yeah, I have a couple of things from Rachel's budget presentation that you didn't get to hear. One of the things was that she was saying that DHS would really like to have, and the governor would like to have us put input on the governor's child welfare improvement monthly report. And we need to follow up on what schedule we would need to give them feedback by so that our feedback can be included in the report. The other thing was that she says they're going to be looking at a budget, a cut scenario with regard to the DHS overall budget. And so she would like to hear from us what priorities we think should be immune from cuts or should basically be prioritized. So that might be an important conversation to have. I was talking to her about maybe preserving all the budget for visitation parenting time.
I missed the beginning of the meeting. Is somebody taking notes for us?
So I've been taking notes today.
Okay, thank you, Judge.
And it's
I also have
recorded.
notes.
And it's recorded.
It's
There's
completely
that.
recorded, so you could go back and listen to Rachel's presentation if you want, Casey. Sarah, I'm in the next day or so, we'll have it posted, the full meeting.
Perfect. I just wanted to make sure our next steps and recommendations were getting on there as well, so we can follow up on them. Okay, well, yeah, I'm sorry I missed the beginning of the meeting, everybody. My court docket has been a little crazy. We got some retiring attorneys and we're taking cases. And so days I try to preserve get filled up with random other cases. But sounds like the governor's office gave a good budget update and has some next steps for us. And then I thought the ICPC discussion was really robust as well. So looking forward to seeing everybody next month. It sounds like we've already got kind of a pretty good agenda set for next month. But again, if you've got agenda items that you'd like to see in the future, please email us and we'll make sure to incorporate them.
Thank you, Casey.
Hi,
Way to
everyone.
step up
Thank
and make sure
you.
people have attorneys, Casey.
Yeah.
Have a good day.
All right. Thanks, everybody.